How is distal pancreatectomy surgery done? Imagine removing a part of the pancreas to fight disease or cancer. That's what a distal pancreatectomy involves. It targets the body and tail of the pancreas, often along with the spleen. This surgery is mainly used when tumors or other conditions affect the left side of the pancreas. The procedure can be done in two main ways. The traditional open surgery involves a large cut in the upper abdomen. The surgeon makes a vertical or left subcostal incision to access the pancreas. They carefully explore the abdominal cavity to check for any spread of disease beyond the pancreas. Next, they mobilize the splenic flexure of the colon, which is the bend near the spleen, to expose the pancreas better. The surgeon then dissects along the edges of the pancreas, identifying and tying off the splenic artery and vein that supply blood to the spleen and pancreas. Once the blood vessels are managed, the pancreas is divided at the chosen point between the body and tail. The cut is made carefully to prevent leakage of pancreatic juices, and the spleen is often removed because of shared blood vessels and to ensure complete removal of disease. The removed tissue is then taken out, and drains may be placed to monitor for leaks. Finally, the incision is closed. Minimally invasive techniques like laparoscopic or robotic surgery are also common. These methods use several small incisions instead of one large cut. The surgeon inserts a camera and tiny instruments through these openings. The patient is positioned to give the best access to the left upper abdomen. Using specialized tools, the surgeon mobilizes the colon and pancreas, similar to the open approach. The pancreas is then cut using stapling devices that seal the tissue to reduce the risk of leaks. The splenic artery and vein are managed with the same careful ligation, but now through small incisions. The removed part of the pancreas is extracted through one of the port sites, often slightly enlarged. Drains are placed to watch for leaks, and the small incisions are closed. The entire operation usually takes about 3 to 4 hours. After surgery, patients are monitored closely for complications like pancreatic fistulas, bleeding, infections, or changes in blood sugar levels. Recovery involves gradually reintroducing food, managing pain, and encouraging early movement. The goal of a distal pancreatectomy is to remove diseased tissue while preserving as much pancreatic function as possible. Whether the spleen is removed depends on the extent of disease and surgical considerations. This operation is complex and best performed in specialized centers with experience in pancreatic surgery to ensure the best outcomes and minimize risks. Always remember, each patient is unique, so your healthcare team will tailor the approach to your specific needs. If you or someone you know is considering this surgery, consult with a qualified surgeon to discuss the best options and personalized care plans.